jointly organized by IEEE Kerala Section, the Institution of Engineers India Kerala State Centre, Computer Society of India Trivandrum Chapter, Project Management Institute Kerala Chapter, Internet Society Trivandrum Chapter, Vakamaulavi Foundation Trust Trivandrum, and IEEE Engineering in Medicine and Biology Kerala Chapter. And today with us, we have Dr. Gopu Harindralal, MDS, consultant periodontist, and he will be taking us through his webinar on Smiling Innocence, all about children's dental health. And this is yet another talk, which is about yet another beautiful part of our face, which defines our smile. And so we really hope to hear from you on this topic and to know more on how we can protect and develop our all the smiling faces around us. And today, it's also really good to know that we have many dentists who have joined us here. And so first, as we move on, I would like to welcome Ms. Aishwarya Ravi of CSI UKF for the welcome address. Can we have you, ma'am?
Thank you. Am I audible?
Yes, ma'am, you're audible.
Good evening to all. I myself, Aishwarya Ravi, and I am here to welcome you all to our 27th Inter-Society Weekly Webinar Series talk on Smiling Innocence, all about children's dental health. And it's my pleasure to welcome you all. First of all, I welcome our speaker, Dr. Gopu Harindralal, consultant periodontist, who preferred to concentrate on the dental health of children. Welcome you, sir, to this event. Then I also welcome Dr. Ashi Fasila, Government Dental College, Indore, Professor S. Nandan Harindralal, sir, and the entire crew behind this. Also, I welcome Fida Fatima and all other eminent personalities to this session. Once again, welcome you all to this event. Thank you.
Thank you, ma'am. Now, I would like to request Dr. Ashi Fazila of Government Dental College, Indore, to introduce our speaker. Can we have you, ma'am? Can we have Dr. Ashi Fazila with us?
Audible?
Yeah, you're audible.
Yes, ma'am, you're audible.
Am I audible?
Yes, ma'am, you're audible.
Audible. Yeah.
Okay, so I'll start once more. A very good evening to all the dignitaries. I consider this as my privilege and honor to give an introductory note on Dr. Gopu Harindralal, who is in fact not only my professor but my mentor also. Dr. Gopu, after he completed his master's degree in pediatric dentistry, he decided to concentrate on the dental health of the children. He worked as a professor in Aziziya College of Dental Science and Research from the year 2011 to 2016. 2017. During his 6-year tenure, he has conducted numerous dental health programs in several schools. He has also imparted his wisdom in the form of many dental awareness talks, not only to the students but also to their parents. He has also conducted several training programs for the dental professionals in the field of pediatric oral health care. For me, this oration will be incomplete if I do not mention how he influences us, his students. Though he is always soft-spoken and considerate, he never allowed his students to go wayward. His disciplined nature reflects in his work also, and the way he treats his patients. We always wondered how graciously he manages the most stubborn children without the use of any form of aggressive measures. Dr. Gopu is extremely passionate about his work, and he always strives towards the betterment of the students. He always tells us to be a better, not only to be a better doctor, but to be a compassionate one. He always pushed us to be a better version of ourselves to face the challenges that life has to offer, both professionally as well as personally. Without further ado, I invite Dr. Gobu to the session. Thank you. Welcome, sir.
Thank you, ma'am. So now it's over to Gopu, sir. Can we have you?
Am I visible and am I audible?
Yes, yes, sir. You're audible.
I cannot see myself here. I cannot see myself here, so if you can have my video on or something. Okay.
Yeah,
fine.
we have your video. Yeah, we have your video.
Okay, thank you so much. Thank you, Dr. Ashi, for this for those wonderful words, and I'm very sure that you're continuing my advices throughout your career, and you'll do it better. Thank you so much. And can you see the screen?
Yes.
Yes, sir.
Okay. Okay. Good evening, everyone. So I hope you all had a very fine day today in spite of this pandemic. Now, when I was asked to talk about pediatric dental health care, really I was in a confused state. How to go about, what all topics to include, because this is a very vast topic. Pediatric dentistry is a very vast topic. Anything inside the mouth of a child is almost equivalent to that of a treatment aspect for an adult. So when I used to travel, especially in a public conveyance or a public transport, after knowing my or after coming to know my profession, many of them would shoot millions of questions regarding their kids' teeth, millions of questions. So I can enumerate in many number of events when I have to keep on answering their questions throughout my journey period. So then I thought that would be the right path for our presentation. So this presentation would be addressing most of the common queries of parents regarding their children's teeth and children's dentition and their children's dental health. Okay, I know, I think we have many dental professionals, and even as Ms. Fida Fatima has told us that we have a lot of dental professionals here. I think we have a little bit of a share of dental students also. So for them, it won't be much beneficial for their academic purposes and for their clinical practice. But I'm very sure that this presentation would be handy for people who are handling parents with a lot of doubts. See, I have done many training sessions for dental professionals, plenty of training sessions for dental professionals. But being said that, I have a habit of quoting so many dental terms or technical terms in my conversation or in my presentation. So for that purpose, I would like to introduce a bit of terminologies for you, so that if at all some dental terminologies come in between, you should know what I meant. Okay, these are the certain terminologies. The first thing is oral cavity. This just means it is a mouth. Oral cavity means mouth. Most of the time in my conversation, always it is a reflex action. It just comes as oral cavity instead of mouth. Basically, tooth has morphologically two portions. One is the crown portion and the root portion. The crown portion means what you see inside the mouth is the crown. But what you have something beneath also. We have something which has been embedded inside the gums. That is called the roots. You have single rooted teeth, you have two rooted teeth, you have three rooted teeth. And in some cases, in some anomalies, you have more than that also. That is about the morphological pattern. And when you section the tooth, when you cut the tooth into two, you can see three layers. The first layer is called the enamel. It is a very thin layer, but this is supposed to be the hardest structure inside the human body. Okay, enamel is the hardest structure inside the human body, and no other structure in the human body is as hard as this thin enamel. Okay, even though enamel is thin, it is very brittle also. It is just like glass. And dentin, the next portion is called dentin. And one more thing, enamel renders white color to the tooth. Okay, the next portion is the dentin. In the picture, you can see certain lines. These lines indicate there are certain tubes or tubules which connect from the enamel to the inner pink portion. Pink portion is called the pulp. That will come later. Okay, dentinal. These are called dentinal tubules. The dentin is present on the crown portion as well as in the root portion. Okay. The next thing is called the pulp. The pulp renders the vitality of the tooth. What do you mean vitality? It is the tooth. I mean the portion of the tooth which gives life to the tooth structure. That is, it contains blood vessels and nerves. Blood vessels are structures that carry blood to the blood to the organs. And similarly, you have blood vessels inside the tooth and also nerves into the tooth. The nerves gives you sensation. You all might have experienced certain sensitivity when you're taking ice cold food or even hot food or something like that. And that is because you have the pulp, you have the vital pulp inside. That is because you are getting that sensitivity. The next thing is called a cementum. Cementum means it is a very thin calcified structure which covers the entire root surface. So that means enamel is that portion of the tooth which covers the crown portion, which protects the crown portion of the tooth, and cementum is that portion which protects the root portion of the tooth. Okay. Now the next two terminologies are very important that we'll be dealing it in detail. One is called eruption and one is called shedding. What do you mean by eruption? Eruption means the tooth breaks into, at a certain point of time in life, a tooth breaks the epithelium. Epithelium means breaks the gums and comes out into and being visible into the oral cavity or into the mouth. That process is called eruption. And the next thing is called shedding. Shedding is a process which is exclusively meant for milk teeth. You know what milk teeth is? It is exclusively meant for milk teeth. So shedding means the milk teeth falls off and subsequently it gives way for the bigger tooth to erupt. Now next is we have two sets of jaws, the upper jaw and the lower jaw. The upper jaw is called the maxilla and the lower jaw is called the mandible. Similarly, the upper teeth is referred to as maxillary teeth and the lower teeth are referred to as mandibular teeth. These are the most common terminologies which we come across very regularly. So regularly, human beings have two sets of teeth in their life, in their whole lifetime. Two sets of teeth. One is called milk teeth, and next is called the permanent dentition, or you can call the big teeth also. For the time being, I will consider this as a permanent. We'll term this as permanent teeth. We have primary teeth and permanent teeth. Primary teeth means milk teeth. The permanent teeth means the bigger teeth what you have. Now, there is always a question, why humans need two sets of teeth? First, you should know how the tooth develops inside the gums. The tooth develops inside the gums. The crown portion develops, and the root portion, and subsequently the root portion also develops. Now, once the crown portion is developed completely inside the gums, it doesn't grow at all. That is the full size of the tooth. It doesn't grow at all. So once the root develops, somewhere around 75% of the root develops, then the tooth comes out into the oral cavity. Okay, so at what time does the tooth comes out? The first tooth comes out at 6 months of age. That will deal in the subsequent slides. The first tooth erupts at 6 months of age. What would be the probable size of the baby at 6 months of age? He'll be very small. Okay, you cannot expect our big teeth to accommodate a very small jaws. So smaller jaws need smaller teeth to accommodate. And when the jaw grows, see all the other areas in the human body grows subsequently as age advances. It grows in size, it grows in length, it grows in breadth, it grows in volume, everything grows. But the tooth doesn't grow once it is formed completely. That is the difference. Jaw grows till he has attained his adult life. Till he becomes around 16 to 18 years of age, the baby's jaw grows. So when the jaw grows, the jaw becomes bigger in size, these tooth won't be able to fulfill the entire length of the dental arch. So for that reason, you need a second set of tooth that is called permanent tooth. For large jaws, you need bigger teeth. So that is why human beings have two sets of teeth. See, the first you should know what are the different types of teeth you have. Your types of teeth you have in a set of dentition. First is called the central incisor. Central incisor is what you see in the middle. The middle tooth is called the central incisor. Then when you go back, that is called the lateral incisor, which has been colored as light blue. And the next is canine, which is colored as a light green in color. The next is called the first molar and the second molar. The first molar is colored as cream and the second molar is colored as purple in color. Now, you need to know at what age all tooth erupts. The first tooth is supposed to be erupted by the age of 6 months, but I have seen cases where it has erupted at 6 months, at 4, even as low as 4 months, and even as delayed as even 18 months. A tooth which is supposed to be erupted by 6 months can get delayed till 18 months of age. 18 months means 1.5 years. Till the 1.5 years, that baby doesn't have any tooth at all. And after 18 years, suddenly 4 teeth will pop up. That's how we have seen that pattern. But normally, in majority of the population, what you see is at 6 months of age, the first tooth erupts. The first tooth to erupt inside the oral cavity is the lower central incisors. The lower central incisors, that is the red color on the lower teeth section. Okay, and then comes the lower lateral incisors, and similar to that time, you have the upper central incisors also will be erupting. So the concurrent erupting time for lower lateral incisors is almost similar to that of the upper central incisors. Lower central incisor will be the first tooth to erupt. Then comes the lower lateral incisors and upper central incisors. Then comes your lateral incisors. Okay, that erupts is around 1 year of age, and you will be expecting the corner tooth to erupt first. But what happens is always after lateral incisor, the first molar is erupting. First molar tends to erupt, and later on, after the first molar, only the canine erupts. So what happens? After the lateral incisor erupts and the first molar erupts, there will be a gap between the lateral incisor and the first molar for the canine to erupt. Initially, there will be a small gap. Most of the time, my parents have asked me, what is this gap due to? What is this gap due to? Is this gap going to continue throughout his life? No, absolutely not. Once the first molar has erupted, you have some more time for the canine to erupt. After the canine eruption, then you have the second molars erupted by the age of 25 months to 33 months, almost 2 to 2.5 months. 2 to 2.5 years of age. Now, okay. Now, so the eruption pattern is first the central incisor will erupt, the lateral incisor will erupt, then the first molars erupt, then the canines erupt, and then the second molars erupt. What will be the time span? From 6 months to 6 years. Okay, from 6 months to 6 years, you will have a full complement of primary teeth. But eruption will stop by 3 years of age. From 6 months to 3 years, at the age of 3 years, the baby should have all the 20 teeth. You have 20 primary teeth here. You can count all these. You have 20 primary teeth. 10 in the upper, 10 in the lower. In our terminologies, we section the arch as quadrants. A set of 4, 5 on the upper right, 5 on the upper left, 5 on the lower left, and 5 on the lower right, like that. Okay, so by the age of 3, the baby should have all the full complement of primary teeth. That is how you have to maintain. And from age 3 to 6, the whole time all the primary dentition only will be present. From the age 6 onwards, you have your permanent tooth starts erupting. Here you will be expecting to get your lower tooth loosened, and you will be expecting your big lower tooth to erupt. but that is not the thing which is happening always. Very little cases, it will happen like what I said before, but most of the time, this is not the case. What happens is the permanent first molar, that is the sixth tooth in the arch, the sixth permanent tooth in the arch is the first to erupt inside the oral cavity. That is at the age of 6. At the age of 6, you have to note that it erupts without shedding of any milk tooth. So you'll be thinking, where is the space? See this in this picture, you can see this picture. You can, I guess you can see my cursor here. This is the primary first molar, and behind that you have your primary second molar. Okay, this is until here you will have your dentition till age 6, and at age 6, at age 6, what happens is the length of the arch increases. That means the jaw grows. At the end, length of the arch increases and creates a space for accommodation of the permanent first molar. Okay, that is how the tooth erupts. Here, the tooth develops inside the gums, and at the age of 6, it erupts into the oral cavity by creating the space by growing of jaws. Okay, and this is very important because most of the parents doesn't even bother to see the teeth which is behind. Most of the parents doesn't even bother, doesn't know that there is a tooth there. Most of them think that this is the primary tooth. So what happens is when they come to us, we'll see a grossly destructed permanent molar. It is very disheartening to see that condition. It's very for pediatric dentists especially. It is a very heart-wrenching scene for us. A very young child with its permanent tooth. A permanent tooth is supposed to be lasting for a lifelong time, and that tooth we have to at point of time we have to pull it out. Like we cannot do anything on that tooth, so we have to pull it out. It's a very heart-wrenching situation. So you need to find out whether the permanent tooth has erupted or not. How will you find out? It is very simple. How many primary teeth do you have? You have 20 primary teeth in your oral cavity. You count your number of teeth. You have, if the number is 20, then you have only primary teeth. If it is more than 21 to 24 at age 6, if it is 21 to 24, 21, 22, 23, 24, either 21 or 24. 21 means either one of the permanent tooth has erupted, 22 means 2 of them has erupted, 3 means 3, and for 24 means all 4 permanent first molars have erupted. That means you have to take care of this tooth. You don't neglect the tooth that it is a milk tooth. Any tooth is supposed to be, for that matter, any tooth is not supposed to be neglected. Even if it is a milk tooth or a primary tooth, it has to be conserved throughout the till its lifetime. Okay. Next, we'll see a rough idea of how the permanent teeth arrives. See, you can see the time gap here. This is the first molar, the bigger tooth. This is the first molar, which is erupting at 6 to 7 years of age. Then comes the lower central incisors. Most of the time, the first molars erupt first, and then central incisors erupt first. At very rarely you can get both together, eruption of both teeth together, and then you have your lateral incisors erupting at 8 to 9 years of age. Then you have your premolars. You should note that I have not told the name premolar in the primary dentition because you don't have a premolar. You don't have a premolar in a primary set of dentition. You have 2 primary molars, but these 2 primary molars are interchanged by a set of 2 premolars instead of molars. Okay, so primary molars are interchanged with premolars, and then, as I told you, by the growth of jaws, they will accommodate the first molars, second molars, and the third molars. So this is how it erupts. In the upper arch, it is like the first molars erupts first, then central incisor, lateral incisor, first premolar, canine, second premolar, second molar, and then third molar. See the age of third molar, 17 to 21 years of age. Yes, that is what you see. At 17 to 21 years of age, that means when you attain wisdom, you get your wisdom tooth. And there starts your own problems also. All adults will have problems associated with this. Mainly at least 70 to 75% of the population will have a problem related with, what do you call that? The third molars or the wisdom teeth. Okay, so that is all about the permanent teeth, the eruption of the permanent teeth. The next thing is, will the permanent teeth shed off by its own, or you need to pull it out? You have a tendency, all the parents will have a tendency that if the tooth is not mobile, you'll start shaking the tooth. If the permanent tooth is not near to the primary tooth, not near to its date of eruption, and you are just pulling it out, means you are delaying the eruption of the primary tooth, or the permanent tooth. Okay, this is the time when you should extract the tooth, or means extraction means pulling out the tooth. This is the time when you need to extract the tooth. If the tooth is loose, the parents only can extract the tooth, or else if the tooth is intact or the tooth is firm, you have to get back to your dentist and get it pulled out. This is the time where you commonly, this is not a very rare situation. This is very common, very, very common. Daily, at least 2 or 3 cases we'll get like this daily, in daily sense. If I go to 4 or 5 clinics, the 10% of the cases will be like this. Okay, the tooth coming inside, and we have to extract the milk tooth. This is the milk tooth, and this is the permanent tooth. Another situation is the tooth has grossly destructed because of decay, and we cannot do anything to recreate that tooth structure or to reconstruct that tooth structure. So what you do is you'll have to pull it out. So after pulling it out, what you need to do is that we'll discuss in the consequent slides. Okay. The next thing is we'll discuss what you are discussing is about the dental decay or tooth decay. We call it dental caries. Okay, I'm not going to tell you the definition of dental caries and all that and all is jargon. And what you need to know is what causes tooth decay. Why you need to know what causes tooth decay? Because you can avoid those things. That is why you need to know what causes tooth decay. There is always a tendency for other doctors, other than dental professionals, to give calcium supplements for dental caries, for established dental caries. You can prevent dental caries with calcium supplements. You can prevent when the tooth is being developed inside the gums. You can give calcium supplements, but not when the tooth is out, and not when the tooth is cavitated. You cannot. The calcium supplements will not help at all. So, what are the 3 causes? This is called a Key's triad. Key is a person that he has postulated this triad, and so it is called Key's triad. It was almost in somewhere around 1960s. He has introduced this. There are 3. You can as engineers you can know. You might know this is something called as a Venn diagram. If my mathematics is right, I'm not sure about this. This is called a Venn diagram, I guess. So this is the first thing is called a microflora, that is the microorganisms. So it is not the calcium deficiency which causes dental caries, it is the bacteria which causes dental caries. So if you have bacteria inside the mouth, that means every time you will have dental caries? No, not at all. In 1 ml of saliva, the number of bacteria what you have inside your mouth is somewhere around 1 into 10 raised to 11 number of microorganisms in 1 ml of 1 milliliter of healthy saliva. I tell you, healthy saliva. So when you have a cavitated tooth, this becomes 10 into 10 raised to 11. It grows exponentially. Okay, so when you have a micro, that is the reason most of the time the parents used to ask me whether the tooth decay would spread. It will not spread. Literally, it will not spread like a contagious disease. No, it won't. But what happens is when you have a cavitated tooth in your mouth, okay, the number of bacteria will exponentially increase. The number of bacteria will exponentially increase. So what will happen? The tendency for the other tooth also getting decayed is more. So that is the role of microorganisms. The next thing is called a substrate. Substrate means fermentable carbohydrates. You don't have to look so much about fermentable carbohydrate. There is only one culprit, that is our sugar. The sugar is of no use in our diet, especially it's just a sweetening agent, and sugar is just a sweetening agent. It is not of any nutritional value. What it can do is it can decay your teeth. Okay, that is what fermentable carbohydrates does. And the next is a host. Sorry, host. Host means you have tooth as well as saliva. You have the saliva inside the tooth, and you have the saliva, or you have the saliva inside the mouth, and the tooth is bathed inside the saliva. Now I'll tell you about the mechanism of how tooth decay occurs. Before that, we'll have an idea of what a salivary pH is. You know what pH is, or everybody would have learned a little bit of chemistry here and there. So you know what pH is. If a neutral pH is 7, and something below pH will be acidic, and above pH will be alkaline. What is a normal salivary pH? It is slightly alkaline. It is somewhere around 6.2 to 7.6. 6.2 to 7.6. So there is a terminology called critical pH. Most of the time, even the dentist, I've seen some dentists, they are getting confused with critical pH also. What do you mean by critical pH? Critical pH means when somebody eats sugar, there will be acid formation inside the mouth. How? I'll tell you later. There will be acid formation inside the mouth, and the pH drops down. Okay, pH drops down at a level of 5.5. Till 5.5, the enamel will be almost healthy. But below 5.5, the enamel starts to dissolute. Okay. And the enamel starts to dissolute. Next thing is how tooth demineralizes. Now, as I told you, the saliva is bathing the tooth within inside your mouth. So saliva contains lots of buffering agents, especially bicarbonates. Bicarbonate ions is the basic buffer system for saliva. You have bicarbonate ions inside the saliva. So when a person ingests sugar, especially sucrose, ingests sugar, what happens is, the bacteria inside your mouth, there are specific names of bacteria that I don't think you will have to know this. There is a specific bacteria which acts on the tooth, but you just have to know it is bacteria. The bacteria acts on the sucrose or sugar, okay, to convert into organic acids, especially lactic acid. You have propionic acid, butyric acid, all such acids they will form, but the most common acid which they form is lactic acid. Once the lactic acid forms, the pH drops down, and when the amount of saliva is, when the acid is not being buffered and not being neutralized, what happens is the tooth starts to demineralize. Okay, so you have to know it is not the worms which cause dental decay. It is the bacteria which causes dental decay. It is not the deficiency of calcium which causes dental decay. Instead, it is the frequent intake of sugar and the subsequent action of the bacteria on the sugar with the presence of the tooth and the saliva in place. It will lead to dental caries. So I'll go back 2 slides back, and we'll see the triad once again. See, you have microflora here, you have tooth here, you have their diet here. It is like a Venn diagram. When all three together form, then only the tooth decay occurs. Okay. If these two are only there, then it doesn't make. If the microflora is there and the tooth is there, and you don't have a sucrose diet, then it is not going to cause any dental decay. If the microflora and diet is there, if the tooth is not there, definitely it's not going to cause dental decay, because dental decay is caused only on the tooth. It doesn't create any problem with the gums. See, this is a bit of technical jargon, but you just have to know the basic of what it is. So this is how what happens when we have a sucrose rinse. Where when you take a glucose drink or a sucrose drink, any drink which contains sugar, or when you have a drink which contains sugar, okay, what happens is within a span of 5 minutes the pH drops down because of organic acid formation by bacteria. Okay, the pH drops down to a certain level below the critical pH. This is critical pH. 5.5 is called the critical pH. Below the critical pH, it will drop down, and Now it is time for the buffering agents of saliva to act. What are the buffering agents? It is the bicarbonates. The bicarbonates in the saliva act onto the tooth, and what happens is it controls it. It buffers the saliva and increases the pH back to its normal within a span of 20 minutes. You will have seen this graph in your orbit and some sugar-free chewing gums and all. You would have seen this graph. The next, if you have not seen, you take and next time you buy an Orbit or something that sugar-free chewing gums, you just go back to the cover and see you have a graph like this. This is called Stephen's curve. So what is this? You will have a certain point of time in, so that means you will have to add one more circle onto the Venn diagram. That means one more you will have to involve one more circle onto the Venn diagram. That is the time. Okay, so that means you have microorganisms, you have the tooth, you have the substrate or the fermentable carbohydrates, and along with that you have time. Then only dental caries or tooth decay occurs. Okay, I think you are really clear about Stephen's curve. The next thing what I will tell you now, then you will understand why I explained Stephen's curve to you. Okay, that I've told you already. There are certain taboos regarding dental decay. That is, it is not caused by worms. It is not due to calcium deficiency. We have seen a lot of physicians and a lot of pediatricians giving calcium supplements to children with dental decay. First of all, it doesn't have any therapeutic value for dental decay. The next thing is what they give is as in a syrup form. What is a syrup? Syrup contains lots and lots of sugar. So for the treatment of dental when you are giving some when you are giving some medicine for your for the intention to correct dental decay, what you are doing is you are worsening the condition by giving more sugar. Okay, this shouldn't be done. So calcium supplements are of no use when you have a cavitated tooth inside your mouth. Next thing is how to control acid formation. That is the method of how you can prevent dental decay. See, you can see here sticky sweets. In the right side of the thing, you can see that you have food pyramid. This is called a food pyramid. Okay, at the base of the pyramid, you have grains. That is, you can have more number of in the grain group. You will have more number of servings, somewhere around six servings can be done in a day. Okay, and the 3 servings for vegetable servings, 2 servings for fruits, 2 servings for dairy products, 2 servings for meat, fish and proteins, and very, 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 very less fats, oils and sweets. Fats and oils are not significant for as far as a dentist is concerned, but sweet is a very dangerous thing as we are concerned. Sweets, any form of sweets, toffees, candies, biscuits. The biscuit is the most dangerous thing what you can have, what you can give to your child, especially if the child doesn't have any tooth decay. If you give few biscuits in the night, that is it. You will have a full length of dental decay over there. Now, this is very important. Avoid snacking between meals. If at all your child insists of giving sugars or insists of giving toffees, you should have control on your child's diet. You should have a control. Either the mother or your father or any other caretaker. The caretaker should be in total control of the child's diet. Okay. Now, you should not give snacks in between your meals. Morning you take breakfast. Afternoon you take meals. You have a tendency snacking in between. They will go into the kitchen, open up some dabba and start munching some biscuits, toffees, get to the fridge, get to the refrigerator, open up some sweets and start munching it up. No, avoid using sweets in between meals. This is very important. That is the reason why I have explained the Stephen's curve here. Okay, See, if at all you have to give a sweetening agent to the child, you should give within 30 minutes of his main meal, not between meals. If you're giving between meals, this is the most dangerous thing what you're going to give. Dentally, his tooth is going to all his teeth are going to get stretched off like a rainforest. Okay, now next is the very important thing: brush the teeth after every meal. There is a century-old habit what we come across, or what we are practicing, because what we do is you rinse your mouth after every meal. This is applicable for children as well as adults. You should brush your teeth after every meal. Brush your teeth after every meal. Anything other than plain water you're taking, you're supposed to brush your teeth. Milk, tea, drinks, soft drinks, beverages, anything what you eat, anything what you drink or eat, you should brush your teeth to eliminate the remnants from your mouth. Whatever you eat should be inside your stomach and not inside your mouth. So that is clearly that should be clearly important for your child also. Okay, increase the water intake so that he'll not get dehydrated. He'll be hydrated throughout, and you have a balanced diet. You follow this food pyramid with the adequate amount of water, and you can prevent dental decay to an extent. Now, before eruption, before any tooth erupts, that is till 6 months of age, the child is completely breastfed. That is the child's, that is the baby's right also. From birth to 6 months, you're not even supposed to give plain water. You should give only breast milk. And during that time, you should make a habit of clearing the milk from the mouth of your child. How can you do it? You can take a clean cloth, roll it into your finger and just rub it throughout your upper gum. These are called gum pads. Okay. Before the eruption of teeth, you have the upper and the lower jaws are called gum pads. So once the gum pads is there, so you might be thinking, why, if there is no teeth inside the mouth, why you need to clean the mouth? Exactly, because before the teeth starts to erupt itself, there will be many number of bacteria which has been present inside the mouth. From the birth itself, the propagation of bacteria will start from inside the mouth, from birth itself. And by the age of 6 months, you will have a lot of bacteria inside the mouth. So once a tooth starts erupting, the tooth is getting erupted in a bed of bacteria. Okay, you need to reduce the content of the bacteria, reduce the content of pathogenic bacteria. That means which causes dental decay. You need to reduce the amount of the number of bacteria which causes dental decay. Okay, and always avoid feeding if the child is asleep. That is, don't feed him. If it is breastfeeding also, and if it is there is no question of bottle feeding the child. If you're feeding the child, then you should not let him sleep with the feed on. Okay, what happens is this milk will get pooled inside the mouth, and I've told you just 20 minutes is enough for to demineralize. Just 20 minutes is enough. If that 20 minutes is not here, if you are not getting the 20 minutes span for remineralization, that is buffering action, then the tooth will start to demineralize. Okay, always avoid night feeding. If at all you are feeding in the night, clear the milk from the mouth and then put the child to sleep. That is what you need to do. If at all during feeding, if he sleeps off, I used to say that this is not from any textbooks, dental professionals, please excuse me. This is from my personal experience. I used to tell the parents that you use your little finger, roll a cotton piece or a gauze piece, and just insert it in between the lips, insert it and just keep and take it out, so that the milk will get absorbed into the cloth. See, this culture should be imbibed first itself. You should not bottle feed that child. After breastfeeding, start off with your feeding cups. According to the American Academy of Pediatric Dentistry, they prescribe that you should use feeding cups from age 1 onwards. From the first birthday, there are two gifts you can gift to there are two things which you can gift the child. One is your feeding cup. Next is, I'll come later. Then this is, from this feeding cup is just a training process. This should not be used continuously. As early as possible, you should shift from, as early as possible, you have to shift this feeding cup, from the feeding cup to your normal glass. Okay, this is always a training period. Your child needs to be trained first, because you shouldn't be prejudiced about your child. A child is always more smarter than what you think. Even if it is your own kid also, if it is smarter than what you think. So you can train your child, he'll do it better than what you do. Okay. And if at all anybody is doing bottle feeding, you cannot immediately stop bottle feeding, because that can cause some behavioral problems for the child. Okay. So this is going to be because it has become an addiction for the child, and it is very difficult to withdraw it. So immediately withdrawing the thing, you'll have a little bit of hassle here and there. So I would suggest one method called serial dilution. That is, you add water into the milk little by little. So 1 week, if you're giving this much amount of milk, okay, if you're giving this much amount of milk, you add this much water in the first week, this much water in the second week, this much water in the third week, and complete water in the next week. So by a month or two, you will have to change the milk from milk to water. This is called serial dilution, so that the child won't understand what is the difference. It should be a gradual change, not an abrupt change. An abrupt change, you will suffer. And it is better not to add sugar to your milk, because it is not any nutritional value. It is not giving any nutrition to the child. The child will get carbohydrates from other sources. The milk already will have some amount of carbohydrates, lactose and all you have. So the child will get carbohydrates by that portion only. You don't have to add additional sugars for that. Okay. And if you are a working mother or you're a working parent, if you have you are giving the child to another caretaker for taking care of. So what you need to instruct the caretaker is strictly clean the mouth after each feed. Okay. It is not very easy if you are not a parent, it is not very easy to clean the child's mouth, because it is not difficult. It is not very it's not an easy method. So you will also have to go through a learning curve. Okay, you will have to learn how to clean it up. You also will have to know how to clean it up. Okay, and the next method is, you can have a little bit of lukewarm water after feeding the child. Okay, after feeding the child, you can give a very little amount of lukewarm water. So what will happen is, a little the excess amount what is present inside the mouth will get cleared off. Or else you will have to clean the mouth, as I told you. Clean the mouth with your cloth. Clean the mouth with the cloth which has been twisted onto the finger. The next is the most common questions which I had faced every time from every parents. When to start using toothbrush? Okay, most of the time they would not bother to brush their teeth even if the tooth erupts. That should not be the case. You should be aware of the time when the tooth is erupting. When the tooth erupts, you should introduce toothbrush to your child. You should introduce a toothbrush to your child, okay? And brush after every feed. Brush your tooth with the toothbrush. Wherever the tooth is present, you brush the tooth with the toothbrush, and brush the other portion and clean the other portion with your finger and cloth, okay? And always avoid feeding the child when he's about to sleep. Okay, I know there are difficult methods that a child will be very much adamant during night times, and he will create a lot of ruckus there. So he will, you will have to compromise your sleep. Your the child's grandparents will also have to, compromise their sleep. So it is always better in the initial stage itself. You need to taper it down. You need to taper the consumption of milk during night times. You have to give milk. I'm not telling you should not give milk. You have to give milk, but the milk should be in the stomach and not in the mouth. Okay, you have to clear the milk from the patient's mouth. Next is a very interesting thing that is called a brushing schedule. Okay, from birth to 6 years, or from the eruption of the first. I've told you, you have to introduce your toothbrush from when the first tooth erupts itself. So from when the first tooth erupts till 6 years of age, you should brush your child's teeth, because brushing is a fine motor skill. Brushing is a fine motor skill. You need to learn that brushing skill. Okay, that will take a period of time. So till 6 years, the child is not able to perform this fine motor skills. Okay, brushing is a fine motor skill. So you need to give the child time to learn that. Okay, so for that thing, to get an effective cleaning method, till 6 years of age, the parents should brush their teeth, brush the children's teeth. Okay, from 6 to 9 years, the child should brush their teeth, but in front of their parent, under your supervision, under the parent's supervision. Okay, and above 9 years of age, you're supposed to brush he's supposed to brush by his own or her own, any child, girl or boy. Okay, this is the brushing schedule. You need to take a note on this. At what age? Or what I used to suggest my patients is, you can allow the patients to, or allow the children to brush by their own when their handwriting gets stable. That is somewhere around 9 years of age. This is a very important culture what you have to imbibe on from now onwards. This is called family brushing. In India, it is not at all practiced anywhere, not even in dentist families. Okay, to be frank, not even in dentist families, this is practiced. But I suggest that you should imbibe this culture as early as possible. You can motivate the child for brushing their teeth, because you are the greatest motivator. The parent is the greatest motivator for the kid. None of them can motivate anything better than a parent can do. Okay. Parents are the best motivators. If you can motivate them, this is the best way. A family brushing technique is the best method what you can adopt in. Okay, you all the members in the family start brushing together. Okay, that will be fun for the child, and it will be they will have an idea of how important toothbrushing is. Okay, and now how to brush the tooth. That is very important. How to brush your tooth. The toothpaste available doesn't create any sort of magic. Any sort of great magic. The magic lies in the method of brushing. Okay. See, for the time being, I'm just stopping the share. Okay. I guess you can see this cast. This is a cast full of teeth. Okay. This is a replica of a jaw. You have a toothbrush here. Okay. This is how you brush. Once you take this. This is not for adults. This is for children. This is the method how you adopt for children, not for adults. Adults have a different technique. Okay, this is for children. It is very easy for them. You should not give any perplexing or some complicated techniques for a child. For a child, when you are giving some technique, it should be very simple. It should be very easy to master. Okay, so what you do is you just take the brush and rotate it like this. Rotate it like this. There are two important factors when you're rotating the brush. The amount of force when you're applying onto the brush will be very less. Okay, you need not give your whole forearm force for brushing. What happens is the brushing, the tooth also will wear off if the force is more. So you don't have to give that much amount of force. What you need to do is, there is something called as plaque deposition on the tooth. Plaque means a biofilm of microorganisms, which is present onto the surface of the tooth. You need to disrupt the plaque by brushing. This is what you do. Round, 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 round. This is how you have to, train your child like round, 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 round. Here also round, round, round. Now, what is it? Now there is a difference of a technique when you come to the chewing surface. When you come to the chewing surface, round, round doesn't work. What you have to do is straight, 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 straight. So in this portion, round, 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 round. Don't forget to brush inside of the tooth also. Most of them, even adults, forget about children, even adults also doesn't bother to brush the inner surface of the tooth. You have to, because this is the area where you will have lots and lots of dirt and lots of calcified dirt happening there. Okay, I'll come back to the sharing screen. So I guess you also have an idea of family brushing. What is the importance of family brushing? Sorry. Okay. The most important. Everybody will be. I can feel the sigh of relief of every parent seeing this question here. Which toothpaste and how much? I am not an advocate of any companies here. Okay, so I'm not going to tell you which company toothpaste to follow. But one thing you need to follow is always use a toothpaste which contains fluorides. Fluoride is a compound. You know what fluorides is? Somewhere, anybody who has gone, in the periphery of chemistry itself will know what fluorine is and what fluorine ions are. So fluoride is a compound which acts onto the tooth and prevents dental decay. It prevents dental decay. So calcium supplements is not the one which you have to give. Instead, you will have to advocate the use of fluoridated toothpaste. That means toothpaste containing fluoride. How will you identify whether the toothpaste has fluoride or not? There are two main compounds which are present in the fluoride form, especially in toothpaste. Okay. One is sodium monofluorophosphate and sodium fluoride. When you buy a toothpaste, you take the toothpaste, any company, X, Y, or Z, any company, you take the fluoride and read out the ingredients. Read out the ingredients and see where either of these two. You won't have both of them together. You see whether either of these two compounds are present, either sodium monofluorophosphate or sodium fluoride. Either of these is there, then it is a fluoride containing toothpaste. Then you can add, then you can buy that and start using. This is for your, what do you call that? This is for you adults as well as even for children also. Okay. Now, there is a problem with fluoride, but the amount of fluoride in toothpaste is very little. But for very young children, you should be very cautious when you are using. Very young children means less than 2 years of age. You will be very careful when you are using fluoridated toothpaste. You should use only a very thin layer or a smear of toothpaste onto the brush. Okay, onto the brush. And you should be, it should be very important that you should be adding fluoridated toothpaste once and only once when the child is able to spit by his or her own. Okay, you can use start using fluoridated toothpaste until, only when your child starts to spit by himself. Otherwise, he'll just swallow it. If more amount of fluoride, if the child swallows the whole tube of toothpaste inside, there is going to be a little bit of toxicity, because fluoride is a little bit toxic. But the amount of fluoride you use is not toxic at all. If it is great amount, the normal fluoride amount what you give is 1 ppm. That is therapeutic amount. What we give is 1 ppm. But when in a fluoride amount, when you are giving toothpaste, when you're applying it in toothpaste, it is just around 0.25 ppm. That won't do anything harm. But toxicity occurs when it reaches more than 8 ppm. Okay, so you know what's the difference between 0.25 and 8. I don't have to tell you what's the difference between these two ppm and all. So if the difference is this, what you use in your toothpaste will be somewhere around 0.25, and more than 8 ppm will cause fluoride toxicity. Okay, what is fluoride toxicity means? Fluoride is a major content, that is in higher concentration. Fluoride is a major content in pesticides, organophosphorus pesticides. So 0.25, 0.5 until 3 ppm and all, it's not going to create some problem. Okay, but more than 8 ppm, it is going to create problems. So you will have to keep a watch on your very young children so that he doesn't eat your fluoridated toothpaste. Okay, that is going to create some problem. So if at all, it is not necessary, always you should have your toothbrushing. I've told you, you should brush your teeth after every meal, but not necessarily you should use your toothpaste and your brush. You can use your brush as well as plain water itself. Plain water, and once in a day you can use a toothpaste, and the other times and all you can use your brush as well as plain water. Next is very important. Most of them doesn't ask me this question, but I want everybody to know what is the importance of consulting a dentist. See, in the American civilization and European civilization and all, there is, if you can remember my previous conversation, you can rule out, you can just recall what I told you. See, there are two gifts what you can give to the child in his first birthday, on his or her first birthday. First thing is the feeding cup. The next thing is your dentist visit. Okay, dentist visit should be your child's second gift, birthday gift. That is how it is. The first dental visit should be on his first birthday, so that it will not get missed. So if you don't have any problem, you just go and consult a dentist and get an advice of what has happened, what you need to do to prevent dental decay, what you need to do to suppress suppress the microorganisms inside the mouth, and how to control your diet. What is the diet pattern you are following? If you want to modify the diet, if you want to change the diet, everything your dentist will help you, or your pediatric dentist will help you. And I would always suggest there should always be an antenatal. Antenatal means before birth. When you are pregnant itself, I think you will have a counseling inside your gynecology department and pediatrics department. But there should be some amount of dental counseling also in a pregnant lady. Okay, don't scare your child. I've seen many parents telling that if you don't brush your teeth, I'm going to get back to your dentist uncle, and he will take a big syringe and start pricking you here and there. No, don't do that. Okay, this is going to be a very regular process. If you start scaring the child by telling this, never ever is going to step on the dental clinic. If at all some problem happens inside your teeth, you will need to go to your dentist and get it corrected. You cannot escape from that. You will have to do. So in the initial stages itself, give a positive feedback with the dentist. So that means a dentist is the person who helps you, giving good smile, helping you smile better, like that. You can positively reinforce the child for like that. Always, before you before you get the child to the dentist, you yourself go and consult your dentist first. Dentist or your pediatric dentist, whoever is available on your local premises. You go and consult. He will tell you what to expect. He will tell you what to expect, what is to be done, what are the normal procedures, what you do. He will explain everything to you so that you can go and transfer this information to your child. Okay, so that he will be prepared for what has been happening. Most of the time, the child's behavior, the child is throwing tantrums during when the child used to throw tantrums because he is scared of what? He is scared of which is unknown. Well, something is going to happen. He will have a feeling that something is going to happen. So I need to shout. I need to escape from this. Something is he is going to hurt me because we are total strangers for children. You are a person who is very much close to the child. We are not. Okay, we will need time. You are staying with the child for 24 hours. We are just being in the child in the close proximity with maybe around 5 minutes or maximum 10 minutes. That is it. That is it. Not more than that. So you should counsel the parent. If you are good in counseling the child will behave better inside the dental clinic, and he will have a non-traumatic experience. Okay, always remember the best behaved child in the dental clinic or in the dental inside the dental chair is always a parent counseled child. That is also from my personal experience. See, I've told you certain techniques which you will need to advocate for preventing dental decay, but there are certain additional procedures which only your dentist can do. Only your dentist or your pediatric dentist can do this. Okay, you cannot do this in your house. Okay, so you can use fluoridated toothpaste, but local fluoride application. Sorry. The local fluoride application has to be done professionally inside the dental clinic. You cannot do it inside your house. One is called a fluoride application. This fluoride application will have a positive effect on the surfaces of the teeth. See, these surfaces will have a positive effect. That is a preventive effect of dental decay. Have an effect on preventing dental decay on these surfaces. But the chewing surfaces are very much pitting, like they are very much irregular. So fluoride doesn't have a great effect on the chewing surfaces. So what we do is we do something called as a pit and fissure sealants. Okay, if they are not, even if the patient doesn't have, even if the child doesn't have any problem, it is always better to use a pit and fissure sealant to use as a preventive measure so that the tooth doesn't get decay. And fluoride application is done every 6 months. It is always better that you use every 6 months do fluoride application every 6 months. Okay. Now, that is all about the preventive procedures, what you come across. Now we are talking about the therapeutic procedures or the treatment procedures, what your dental profession is doing. Okay, these are the most common things. You might be very much familiar with what you have seen in number 1, 2, and 3. And I am sure that the other three, the 4, 5, and number 4, 5, and 6 will be new to you. We'll discuss that in brief. Okay. The first thing is cleaning of teeth. Cleaning of teeth. Okay. What you see here, this is the inner surface. That is the portion of the tooth which is facing the tongue. Okay. This is the portion of the tooth which is facing the tongue. You have lot of yellowish discoloration here. This is called tartar, and there is something called as calcified structure, which is called as calculus. Okay, calculus are hard structures that has become calcified in over a period of time. Okay, and professionally, you need professional cleaning for these type of cases. Okay, once you do the cleaning, your teeth will be like this. If it is left like this, neglected, what will happen is your gums will get swollen. The gums will come down, and more amount of tooth is getting exposed. The support of the tooth will get lost, and the tooth starts to get loose and just fall off. Okay, this is not for primary tooth. I'm telling about adult tooth also. Okay, primary tooth, you do some amount of scaling, but it is very important that you consult the dentist. Avoid scaling, because if you can avoid scaling if you're doing a brushing procedures or brushing protocols properly. Okay. Now restorations, that is what we call, normally you will be familiar with the term fillings. What are you filling it? What are you filling, and where are you filling, and what is it with what we are filling? That is very important. Okay. See, you can hear there is a black spot here. This is dental decay. The beginning of dental decay, what you do is just drill the tooth and make a cavity over here, and you restore and fill it with either a cement called glass ionomer cement or something called as composite resin restoration. Okay, you can see similarly you have some decay tooth in the front tooth. This is the front tooth. Okay, the dentist have removed the decayed portion over here and filled it with a restorative material or a filling material. This is how it looks after that. Okay, and if the tooth is, if the more amount of surfaces are involved in decay, then your dentist will prefer a cap on top of it. Instead of giving a filling material, instead of giving a normal filling, your dentist will give a cap. This is called a stainless steel cap. This is meant only for children. Okay, this is only for primary tooth. In adults, you give a different types of. This is stainless steel. This is stainless steel crowns what they have given. And recently they have introduced something called as zirconia crowns, which is, this is the case. These are the 4 teeth which are decayed, and see You can hardly make out the teeth is decayed right now. The decayed tooth is inside. The decay has been removed and you have restored with a zirconia crown. Zirconia crown. This is very good looking also. Okay, if the child is more aesthetically appealing, you can use this. It's quite costly though. As a pediatric dentist, 90% of our cases, 90% of what we do is mainly this, root canals for milk teeth. 90% of the cases coming to the dental clinic or to the dental college is for these procedures, especially children. These are the cases what you do. So every time we have a hard time convincing the child or forget about convincing the child. Hard time convincing the parent to do a root canal treatment for a child, for a milk tooth. You don't call it a root canal treatment when it is concerned with the milk tooth. You call this term pulpectomy. You can do a pulpectomy for this tooth. What do you mean? What is pulp? This is a radiograph of an X-ray of a tooth, and you can see a black line over here. This is the pulp space. Okay, pulp space. And once the caries has been, if the caries is very deep, and this is involved the pulp, then the pulp will get decayed completely. The pulp will get dead. Okay, so what you do is you remove the dead pulp tissue and fill with a inert filling material inside the root canals. This is called pulpectomy. Okay, so the next thing is why you need to do a pulpectomy for a tooth. You have a main question. I know everybody is telling this question. It is a primary tooth, milk tooth. It is going to shut off. Why you want to do all those complicated stuff onto the child? I'll tell you. See, every tooth has its own lifespan. For an example, I'll tell you, this is the first molar, primary first molar, and this is the primary second molar. Primary first molar is supposed to get exfoliated by the age of around 10 to 11 years of age, and around 10 to 12 years of age, this tooth will exfoliate. This is a child who is just below 5 years of age. He may be 3 or 4 years of age, this child. Okay, so what is the how much time will have to wait for the underlying tooth to erupt? Somewhere around 7 to 8 years you need to wait. If you are extracting this tooth, if you're pulling this tooth out, what will happen is there is a tooth which is coming behind this tooth, behind the primary molar, that is the permanent first molar. Okay, this permanent first molar will migrate into this space and destroys the space which is available for the eruption of these two premolars. Okay, there will be a lot amount of space loss. Either the tooth will not erupt, or the tooth will be erupting on the lingual portion means on the surface of the tongue, on the side of the tongue or on the side of the cheek. It won't be coming directly onto the arch surface. Okay, so this is why you need to maintain the tooth. You will have to maintain a primary tooth till it sheds off. That is its lifetime. Shedding time is the lifetime of a primary tooth. Till that time, that has to be, maintained. But unfortunately, we see some cases that this primary tooth is destroyed to such a manner that it cannot be restored at any point of time. In such cases, we need to extract that tooth. So what will we do after extracting the tooth? We'll come to the next slide. That is how you treat your crooked teeth. What are crooked teeth? I'm not sure whether the term crooked teeth will be familiar for you. You know that either the tooth being like this will be either like this, or your tooth become proclined, or tooth become retroclined, or whatever it is. Even if the tooth is not in its normal position, it is called crooked teeth. That is what it means, mal-aligned tooth. Okay. See, there is a term called space maintainer. I told you, if you are extracting the primary tooth way before the eruption of this permanent successor, what will happen? This tooth can migrate forward and this space can get lost. If the space is lost, if for example you have 5 mm of space here, The tooth has migrated and 5 mm of space has become 3 mm of space. 2 mm of space you have lost. So this tooth needs 5 mm of space for normal eruption. If there is if there is only 2 mm of space, how will this tooth erupt? It won't get erupted. Okay. Now, so that is the importance of a space maintainer here. You extract the tooth out and you find out that the tooth is not going to erupt in near future. Then you will give something called as a space maintainer. Space maintainer. The name itself tells you everything. This is an appliance which is given to maintain the space created by the prematurely lost primary tooth. A prematurely lost primary tooth will have some space problems. To avoid that, you give space maintainers. Okay. Next thing is oral habits. Most of the children will have these kind of habits, thumb sucking habits. But most of the parents doesn't know that we can do something about stopping thumb sucking habit. Okay, we can prevent thumb sucking habit. We can correct thumb sucking habits, but it should be at the right time. When it should do will come in the next slide also. And there will be a mild amount of tooth corrections here and there. You can do it in the early ages itself. So whenever you see a dental problem, you don't have to wait till 12 years. Immediately go to the dentist. If the dentist tell you to come after 12 years, then it is okay. You don't have to decide by your own. If you have any doubt, go and have a professional advice, and don't ask your neighboring aunties or uncles and grandmas, grannies, and grandpas for professional advice. If you have any idea, if you have any doubt for your engineering sessions, you will ask your professionals. If I have anything, if I have a legal problem, I will go and consult my advocate. If I have if I need to construct a building, I won't construct by my own. I will consult an architect first. Similarly, if you have a problem any problem in your medical field, consult your medical professional or a dental professional, and don't go with your own conclusions. That is a very bad, a bad habit, and I don't carry it through. Because I'm seeing, I'm telling this again and again because I've been seeing throughout, because patients come and dictate me that this is to be done, this is to be done. See, we are the persons who have been experienced for years together for doing all these treatment procedures for children. So better you come and it is always better you get a professional advice on the area required. Okay. Next is a very important thing: when to get braces. Even the dental professionals have a tendency, especially general practitioners have a tendency that to recall the patient after 12 years. That means the braces only have to be done after 12 years. No. The malalignment can be divided into two. That is the problems related with the tooth and the problems related to the bone. The teeth problems can be corrected at any age. Any age. After 12 years and all, you can correct at any point of time. But if it is a bone problem, if the problem is with the bone, if it is a skeletal problem, then you will have to correct on the time where the child grows. Okay. So whenever you are in doubt, you just go and consult your dentist. That may be the right time. If it is, I'll tell you what is the time, what would be the correct timings. If you are tending to correct a thumb sucking habit, even we say it is impossible to correct a thumb sucking habit in a 1.5 or a 2-year or 3-year-old child. It is not possible at all. Okay, that will create some other problems. But what in our literature, it has been told that thumb sucking habit is normal till 4 years of age. From 4 to 7, thumb sucking habit should be eliminated by any methods. That your dentist will tell you what all are the methods. Okay, so but what you need to know is you will have to get your child, if the child has a thumb sucking habit, get your child to the dentist at 4 years of age or even before 7 years of age. Okay, that is the best age to intercept. After 7 years of age, the problem is going to get a bit more complex, because the dentist will remove the thumb sucking habit, but when the stress happens onto the child in a later age, this can redevelop. That is what happens after 7 years of age. Now, if you have a bone problem, if the bone is proclined or the bone is pushed in on the maxillary arch or the mandibular arch, in the initial stages, slides, I've told you what maxilla and mandible is. If the maxilla arch is proclined, if the mandible arch is proclined, giving braces alone, that spot braces alone won't help. Initially, you will have to control the growth. You will have to either control the growth or change the direction of the growth. That is what you need to do. That is what the dentist do, or even the orthodontist or your pediatric dentist will do that. And later, then you have dental problems. After that, you can correct your malalignment of tooth. The malalignment of bone has to be corrected first. See, if you are building a house, your basement should be proper. Okay, if the basement is here and if the basement is here, okay, if the basement is here, the block should come here, like here and here. Now, if the basement is here, you are not supposed to build your building in this portion. So you will have to reshift your basement. The basement is the alveolar bone or the maxilla or the mandible. The building blocks are your teeth. If the base is not proper, your building blocks will also get will not be in a correct position. Okay. But if the child crosses his age, the bone correction is not possible orthodontically, then you will have to go for major surgeries and all. To avoid surgeries, it is always better to get your child to a dentist as soon as possible, so that he can modify the growth and he can change the direction of the growth. I think it's clear. And basically, it was not intended. I was not intending to put this slide. Actually, there are two more slides which I have to explain. I didn't want to put these slides, but there are certain instances which I have seen. A child falls down, okay, and loses his tooth completely. The tooth will pop out completely. It is not broken inside. It just pops out completely. Immediately the parent will come back. Bring the child back to the dentist, but not with the tooth. That is a problem. What will we do without the tooth? The tooth is lost. If it is a permanent tooth, this is not going to come back. This is a permanent tooth. This is not going to come back. In this picture, it is a permanent tooth. See, these are the permanent dentition. The 4 permanent teeth. One teeth I've lost. You cannot. I'm very sorry for the offensive. This is for we used to put for dental classes. I know the other professionals will get offensive with these pictures, with this kind of pictures. I'm very sorry for that. But this is very important. That is why I'm telling you. Now, what you need to do is immediately, if you find the tooth has come out, if the tooth is missing, what you need to do is you just search the premises where the child has fallen down. Search the premises. If you can find the tooth, hold the tooth by its crown. Very important. Hold the tooth by its crown and not by the root. This is the crown portion. See the white portion here? This is the crown portion and this is the root portion. You need to hold the tooth by the crown and not by the root. You are not supposed to touch the root. Mind you, you are not supposed to touch the root. Okay? Obviously, the root, the tooth has fallen down in a messy atmosphere or in a dirty atmosphere. You will have dirt, you have mud, you will have all sorts of things here. What you need to do is hold it by the crown portion and show it under running water. Show it under running water so that the dirt will get removed. What you need to do is the next step is, if the child is cooperative enough, if the child is okay, then you have to replant the tooth back into the socket. Replant the tooth back into the socket. Don't leave him like that. Immediately rush to the dentist. Because when if a non-professional is doing this thing, there are high chances that you can shift it ulta, shift it in the opposite direction, and place the tooth in the opposite direction. Only a dentist can put that in the right manner. Okay, so you just put it inside and then rush to your dentist. If you put it in the right position, the dentist will splint it. What you do is, if you have a broken hand, your orthopedician will plaster your hand, right? So that likewise, you have this is called splinting. You're plastering the hand is called splinting. We also do the same procedure, not plastering. We'll do it in another manner. You do it. The dentist will splint the tooth, and you will have to recall, and they'll recall within subsequent 2 weeks or 4 weeks or something like that, depending on the severity of the case. And you will have to place it back and ask the patient to bite a piece of cotton or a piece of cloth, and then immediately rush back to the dentist and instruct him strictly, but not to move the cotton piece or not to move the cloth piece. This is very important. If this is not for your child only, if at all you are seeing any other kid falling like this, you can help them. Okay, so that he won't lose his tooth. Another situation. it is for a non-dental professional, it is not very easy to place the tooth back into the socket because you're not familiar with the anatomy, you're not familiar with the premises, everything. So what you need to do is, you can, if you're not able, try to push it back. If it is not possible, you just wash it out and keep it in milk. Okay, this is called a storage medium. This is a very simple storage, but you have a lot of complex storage medium which you store inside the dental clinic and all. But what is available for you is plain milk. Everybody buys milk early in the morning, and if you can get coconut water, it is very good. Coconut water is better than milk. Okay, if it is milk, you place it in milk and rush to the dentist, because here the time is very important. This is called the golden period. You have to get back within 1 hour of time, you will get the maximum results. It does not mean that after 1 hour, this is the treatment won't be successful. It can be successful, but the probability of getting success is very less if the tooth is being replanted after 1 hour. So the golden period is 60 minutes or 1 hour. I think I have, I'm done with the presentation here. So I thank all the, the above said, the organizations too, and giving me this opportunity to enlighten you about the child dental health care. I think you would have a fruitful, you had a fruitful, a session attending this lecture. So I think we'll conclude this conversation and go back to the question and answer sessions here.
Thank you, sir.
I have a request for the moderator. I think there are so many parents sitting there, and
yes.
So many parents sitting there. They will have a lot of questions, and as a pediatric dentist, I know it is my duty to clear all these. So you don't need to sieve the questions. Just directly flow in that, and I'm ready to answer it. Any number of questions and any number of times also. I know it is difficult for you for a time in a time constraint. It is difficult for you, but
no, sir.
As long as possible, if as your time allows, I am ready to stay.
Yeah. Okay, sir. So the first question is, what's the right age for cosmetic dentistry for children? Why is tooth sensitivity more prevalent among adults than in children?
Yes. See, first, is it the same person? It's a question from
it's a question from Tyler Ananthakrishnan.
No, both the questions are same. I mean, from the same person.
Yes, sir.
Okay, can you repeat the first question once more?
What is the right age for cosmetic dentistry for children?
Cosmetic dentistry means any age. It can start from there. What do you mean by cosmetic dentistry? That is, if the child has any disfigurement of the tooth, that has to be corrected. That is called cosmetic dentistry. When do you see the disfigurement? That is the right time. There is no specific time to that. You should not go here. We have done cosmetic treatment for 1.5-year-old children. 1.5-year-old children, as low as 1.5 year, I mean, as young as 1.5-year-old children. And coming to the next part of the question, see, there is a kind of vasculature of, there is a difference in vasculature between the tooth, between primary tooth and permanent teeth. Okay. It is not that the child won't have sensitivity. The child will have sensitivity only when there is decay of the tooth. But that is not the same in case of adults. In adults, the biting force will be more. So the wearing of the tooth also will be more. When the enamel is lost, the dentin will get exposed. And there you get sensitivity. But the biting force is less in children. So the wearing also is very less. I'm not telling that there won't be any kind of wear. There will be a kind of wear. But the thing is, the wearing will be less. And that is why you get less amount of sensitivity in children. When you prepare the tooth also, the vasculature is very bizarre in primary tooth than in permanent teeth. That is why you get sensitivity for permanent teeth and not for primary tooth. Next question.
Okay, sir.
I think it is clear for the person who has asked it out.
Yeah, I hope so.
Yeah.
So the next question, we see some children gnaw their teeth in sleep. What's the reason and the remedy? Does the water we use every day have some effect on our teeth in the long run?
You're asking for stains? Stains?
No, yeah, maybe. She's asking, is there an effect of water on our teeth on the long run?
Water on the teeth on a long run. See, water when you depending on the source of the water. Depending on the source of the water will have so many contents. Iron containing, water may contain iron. The most important thing is iron, the water containing fluorides. And in some area where you have well water, the fluoride content is more. I told you at point of time after when the fluoride content is more than 4 ppm, the child will have dental problems. There will be a mottling. There is something called as mottling of the tooth. There is a condition called fluorosis, where in your drinking water, if more amount of fluoride exposure to the tooth is more, then the optimal ppm for optimal concentration of fluoride in a normal teeth is 1 ppm. If it is more than 4 ppm, the tooth will get mottled. There will be some white specks, some brown spots in the teeth. That is the main problem with water in dentistry. Fluorosis.
Oh, okay, sir. So the next question is from Sharon Thomas. The 2 adjacent permanent teeth of my son is not in the same line, even though there is enough space. Can you explain?
First, we have to know which tooth is that. If it is in the center, if it is the permanent tooth, see, there are so many reasons why the tooth is getting, dislodged. If for that, you have to do a complete checkup with the help of radio, with the help of X-rays, with the help of casts and all. You need to have a thorough checkup, and then only you can find it out. There are so many reasons. If you have an extra tooth inside the gums, then also the tooth can deflect. If the tooth the primary tooth has been retained and the permanent tooth has erupted without shedding of the primary tooth, then also the same thing can happen. You need to know the reason first and then go for the remedies.
Okay, sir. Okay, so the next question is, what is the reason for some children having milk white teeth, some having pearly white teeth, and some having dull white? What is the doctor's advice on dental implants for children?
No, absolutely no for dental implants. Dental implants are supposed to be placed only after 19 years of age. Because dental implants are static material what you are placing into the bone. They won't grow. They are not resorbable also. Right now we don't have any resorbable implants present. But if you have a trauma or if you have doing a cranial surgery, recently you have resorbable plates when you do a surgery. That is good for children. But implants, you don't have any resorbable implants or expandable implants. Implants are static, but these implants can stop the bone growth at that portion of area. So it is better you finish the growth and then go for implants.
Okay, so the question was also that what is the reason for the color change, like from milk white to or pearly white or dull white? So would you like to comment on that?
My skin color is dark in color. I think Fidas is somewhere around fairish in color. We have seen Dr. Ashi Fasila, which is more fair in color. So they have personal preferences. The personal changes are always there.
Okay.
That is there. Personal changes. Not every tooth is the same color. They have you can have a pattern, but no, it's not exactly the same. If you have specks, if you have white specks, then that is due to enamel. There is a condition called enamel hypoplasia. If it is totally the same color, then there is nothing to worry about it. Your skin color and your teeth color will have some different. You have some correlation there. Definitely, there is a correlation.
Okay, sir. So the next question is from Dr. Jalish. My son is 8 years old and has his central incisors protruding outwards and slightly laterally. No respiratory issues, thumb sucking or difficulty in closing mouth. Should we intervene at this age? Can we start using it?
One second. In the question, is it mentioned that he has a respiratory problem or snoring?
No, he doesn't have a respiratory issue.
Doesn't have a respiratory issue. Okay. So the problem is there is a gap between the central incisor, is it? or is it protruded?
It is protruded. The central incisors are protruded outwards and slightly laterally also. And thumb sucking or difficulty in closing mouth is, I think so, that's also there. And
Thumb sucking is there? Thumb sucking is there? If thumb sucking is there, the first and the foremost priority is for thumb sucking. You have to eliminate thumb sucking first. Then only you can initiate any kind of orthodontic treatment. Otherwise, this is going to be a waste. You eliminate thumb sucking first and then go for correction. Then you have to if he is not a dentist, if that person is not a dentist, get back to the dentist immediately and find out whether the problem is with the tooth or whether the skeletal base. If it is a skeletal base, you have to intercept it in a very early age. If it is a dental problem, you can postpone the treatment, no problem. But thumb sucking, you have to eliminate it immediately. That is what I suggest.
Yes. Okay, sir. And should we intervene at this age, or can we start using any devices at this age? That's what he's asking.
If it is a skeletal problem, the dentist will give you certain appliances to, what is the age? 8 years.
Yeah, sir. 8 years.
8 years. So if the problem is with the upper jaw, this is the right time to intercept. If the problem is with the upper jaw, if the tooth only is with the problem, the dentist can identify this, whether the problem is with the tooth or whether in the skeletal base. If the skeletal base is the problem, then you will have to identify, then you will have to correct it now itself. 8 years is the right time to intercept.
Okay, sir. Thank you, sir. So the next question is from Shamla Shashidharan. Dental caries is hereditary in the case of some.
No, not at all. Not at all. There is no studies which are showing you that dental caries is hereditary right now. But recently, I'm very much off-handed. After joining the health service, I'm recently off late with the with the articles regarding dental caries. I'm deep into the clinical aspects of other things, clinical aspect of clinical treatment aspects. The dental caries, I'm not, but till what I know, hereditary is not a cause.
Okay, sir. So there's a question
if at all you can quote hereditary as a cause, you can prevent dental caries by proper measures.
Okay. So the next question is from N. Ravindranath. I find in some children, permanent teeth at the front of oral cavity are having gaps. Why this is developing? Why is this developing? In other cases, I noticed the two teeth are projecting out compared to other teeth. Why such defects are developed? Suggest the remedies to avoid such defects.
In one word, you can tell that this is a condition called arch length tooth material discrepancy. So there is a parity between the arch length, arch circumference, and the tooth number present, and or the tooth size present. It should be compatible. If the arch length is small and the tooth material, if the tooth width is more, then you will have crowding of the teeth. If the arch length is bigger and the tooth is small, you will have spacing of the teeth. That is what happens every time. The arch will be growing bigger and the tooth will be shorter. That is why you will get spaces. That can be corrected orthodontically completely with braces.
Okay, sir. So I think so. Yes, I think so. Yeah, there's one more question. The first prominent incisor erupted behind the second primary incisor. The lateral one has not started wiggling yet.
Please.
So should we?
Once again, please.
The first. Yes, sir. The first permanent incisor erupted behind the second primary incisor.
Okay.
The lateral one has not started wiggling yet. So should we get the lateral one extracted?
This is all case specific. You cannot generalize everything. You should see the case first and then only decide. Most of the time, if it is a central incisor which is being pushed inside, it is always better to pull it out. I mean, not extract it. I am telling you, just move it outside so that it will be in a normal position. If the lateral incisor is inside, you can delay the change. You can delay the treatment. If the central incisor is in an inward position, you will have to get it back to the normal position as early as possible, because this can cause skeletal problems later.
Okay, so there's the next question from Dr. Geetu Sara. In a 13-year-old child with deeply carious 26 involving pulp with slightly proclined upper centrals, which is the right treatment of choice? Is it extraction or RCT of root canal, maybe RCT of 26? If the child has to undergo orthodontic treatment in future?
There are two schools of thought in this. This is definitely a dental professional's question. So I would explain it in that manner. So 26 is deeply involved, deeply carious, and it's not grossly destructed. If it is restorable, then I would suggest you can do a root canal treatment and then crown the tooth, and then later go for orthodontic treatment. There is another school of thought is if 2-7 is unerupted, you can extract the tooth so that the 2-7 will migrate towards the 2-6 space and occupy the space of 2-6. There is another school of thought, but I would prefer the former one. I would prefer the former one always. And after that, orthodontic treatment is also not a problem. Orthodontic treatment is the 6 or 7, you can take it as an anchorage tooth, no problem at all.
Okay, sir. So is there any special method for differentially abled children?
Yes, definitely. Definitely, yes. You should have. That is why they are called specially able children. You should have special methods to maintain do treatment for them. Every treatment, including the smallest or the simplest treatment to the most complex treatment, everything should be modified and everything should be according to the personal preferences for the child itself. The special child, the child is the king there. You should come down and do according to the children. There is no question about it. Obviously, there is always a change. That is a totally different topic. Special children has to be given different care, totally different care.
Okay, sir. So can I move on to the next question, sir?
Yes, please.
Okay. There's a question from Dr. Muhammad Ibrahim. Will it cause any mental retardation in children less than 2 if they swallow it?
There are no studies which he's asking about fluorides. There are no chances like there will be some amount of there will be some amount of mental disturbances in the initial stages. That is a symptom itself. But mental retardation is not an issue. It is not that much severe. It won't cause mental retardation. I've never come across such an article also. There will be irritability and there will be some amount of mental disturbance, transient mental disturbances in such.
Yeah.
Okay.
Yeah. Okay, sir. So there's a statement from Dr. N.N. Panikar. Self-cleansing is what we have in nature. So he would like to know your suggestions on the statement.
Absolutely. Self-cleansing is obviously a nature, but what you eat now, recently what you eat now is not fibrous food. We are all accustomed with the refined food. We are not using fiber food like the old, what do you call the ancient people used to do. The ancient people didn't have any dental caries. When dental caries started to occur is after the introduction of sugars, refined sugars especially. When you are removing refined sugars from your diet and completely exclusively go for fiber diet, then self-cleansing is a good option. Saliva has got a self-cleansing activity. But brushing you cannot exclude. It is not a.
Okay, sir.
It is not a.
So another question from.
Yeah, carry on, no problem.
Okay, sir. Okay. There's a question from Shinju to you, and that is, what is the difference between plague and tartar?
It's not plaque, it is plaque. The thing is called termed as plaque. Plaque and tartar. See, plaque. It is a tartar means it is just a film of dirt. That is it. It is a film of dirt that is called tartar. Plaque is a very significant term. Plaque is not visible through your eyes. When it is visible through your eyes, it is called tartar. So a plaque is not basically visible through your eyes. You should give some amount of disclosing agents. That is, you will have some wafer, some erythrocin dyes and all you will have to chew. And you can see the reddish coloration of your tooth. That is the portion of a plaque. Actually, it is not visible through your naked eyes, but it contains millions and millions of microorganisms. If the plaque is a major reason for dental diseases, either dental decay or even gum diseases. The major cause is plaque. Plaque is you cannot, it is not a small term. Plaque is a huge, it's a biodiverse, terminology.
Okay, sorry for the mistake, sir. So there's another question from Alma Saifuddin. What to do if a child falls down and the tooth is mobile and there is a slight fracture?
Is it a dentist? Is she a dentist? No, we will have to answer accordingly. That's right. If she is a dentist, she is expecting a clinical formula there. Otherwise, she's asking for help.
Okay, there's no mentioning, so.
Okay, just for the time being, I'll just assume that she is a dentist and then I'll answer the question. Okay, if the tooth is mobile and the tooth is not displaced, initially what you do is you just splint the tooth. Splinting the tooth means you're just making the tooth immobile so that it doesn't move. Just giving the tooth a bit of rest. If the tooth is fractured, you can restore the tooth with the fracture line with a composite restoration also. There is no issue. But first priority has to be given for splinting the tooth. Fractured tooth, you can treat it afterwards.
Okay, sir. Another question. Sir, does drinking milk during sleep in a baby under 6 months increase caries?
Under 6 months, see, I told you there should be presence of tooth first. For caries, there should be presence of tooth. See, if you're continuously feeding the child in the night and not clearing the milk from your mouth, from the baby's mouth, what will happen is you will not know when the tooth is erupting. So the tooth is going to erupt in a pool of milk always. So once the tooth, most of the time, the parents used to ask me, the tooth already had come with caries. No, the tooth won't come with caries. The tooth once come out, the bacteria acts on the tooth and then acid forms and then decay occurs. It is because of you. You are causing caries and not nature. Because of your negligence, caries occurs. No, because if tooth is there, caries will happen. If the tooth is not there, there are high chances of caries to develop when the tooth erupts. I guess it's clear.
Okay, sir. I think so. That's fine with the person who asked the question. And so the next question is from Mohanan Nair. In 1960s, one senior dentist used to advise his patients to massage gums regularly. How important is it for children nowadays when they are using only brushes and not fingers?
Fingers, massaging the gums, it will be helpful. It will be helpful to increase the vascularity increase the blood supply of gums. Okay. Yeah. Otherwise, brushing is not. You cannot substitute anything for brushing. Anything for that matter. Brushing is a mandate. You cannot omit brushing and do finger brushing. No, absolutely no. Finger has no cleansing activity, absolutely zero cleansing activity of the teeth. Teeth has to be brushed with your toothbrush itself, with your nylon toothbrush itself. Mechanical toothbrushing has to be done. There is no substitute for mechanical toothbrushing. If you want, you can do your gums, massage your gum. There is no harm in it. But for children, you should do it very cautiously, because when you are massaging the gums, you are applying some amount of force. The child is a pliable, child is a pliable environment. So when you are applying the force, there will be changes in the bone. There will be changes in the growth of the bone also. So that you have to be very careful. Adults, when you are massaging the gum, there is no issue. With your fingers, there is no issue. For children, you have to be very careful. You don't have to increase the vascular blood supply of a child, because always for a child itself, the blood supply is immense. There is no compromise of blood supply in your, especially in your head and neck area. There is no compromise also.
Okay, so there's another question from Fatima Suhair. Can teeth sensitivity be controlled?
Teeth sensitivity can be controlled clinically. There are so many reasons for and there are so many unexplained theories regarding hypersensitivity. That is the main reason. This is an unexplored, this is the most unexplored area in dentistry, hypersensitivity. There are a lot. We have many treatment protocols for hypersensitivity, but the first and the foremost thing what you need to find out is what is the reason for hypersensitivity. Any disease, you need to find out the treatment and then correct the remove the cause and then treat the problem. The hypersensitivity can be due to dental caries. The hypersensitivity can be due to tooth wear. The hypersensitivity can be due to multiple crises on your tooth. Crisis means multiple fracture lines on your tooth. The hypersensitivity can be due to root exposure of the tooth. So many reasons. First, you have to identify what the reason is, correct the thing, and then you go for a general hypersensitivity control protocol.
Okay, so another question from Hariharan N. Which is preferable, gel toothpaste or cream type?
Anything which your child is comfortable with. Your child should be, whenever he is going to brush his tooth, the taste of the toothpaste shouldn't pull him back from brushing. That is the most important thing what you have to keep in mind. Whether it is gel, cream, doesn't make any difference. I told you that toothbrush doesn't give any magic. It is the method of brushing which counts. Your method of brushing should be proper. Then it's okay.
Okay, sir. Another question from Zera Ramshad. So what's your opinion about tooth mouse? Moves maybe. Pronunciation is
tooth mousse. It's a tooth mousse. Yes. It's your mousse only. You know what mousse you know, that is the mousse. The same thing. Tooth mousse. See, tooth mousse is a great product. I am not sure whether this is a dentist or a layman person. But if it is a layman person, your first thing is, see, you have to know what is the stages of the first stage of dental caries is a white spot lesion. This is reversible. Okay, this can be reversed with the help of tooth mousse. Okay, I'm not going to tell you the chemical formula of tooth mousse and all that is insignificant. Tooth mousse is a product. It is a company, is a product marketed by a company called GC. It's a great product, very good results, but continuously you will have to use it for 6 months for good results. And this is made from casein. Casein is a milk protein. So if your child is not allergic to milk, you can use this. And if there is no problem if the child swallows it also. That is a major importance. If you're using fluoride, if the child swallows it, there will be a little bit of problem. But if it is tooth mousse, if the child swallows it, no issues at all. It is like swallowing milk. But there are products like GC Tooth Mousse Plus, which contains fluoride. That has to be used with caution. I won't use GC Plus, Tooth Mousse Plus. I would use only plain tooth mousse.
Okay, so there's another question from Hariharan N. What other additives are good in toothpaste? Additives for gum strength and to avoid decay. Are they different from one another?
There is only one formula for gum strength. Keep your teeth devoid of plaque. There is only one formula for gum strength. Okay, if there are a lot of bacteria in your tooth, this can affect the gums. The gums will get inflamed first, and then the gums will recede down. Recede means it will just come down, and it will lose its. The tooth will have an outer covering of bony structure. Okay, and the bone will get dissolved, and the tooth will get loose. That is the sequelae of normal gum problems. Okay. So what was the final question there?
Okay.
What was the final question?
His question.
Yeah.
Yeah, he was asking whether the additives for gum strength and those to avoid decay are different from each other.
No, additives for gum strength. It is just. I would suggest that this is just jargon and marketing gimmick for increasing gum strength. There is only one formula for increasing gum strength, and fluoride is the only content in toothpaste which can prevent dental decay.
Okay, sir. Another question. Is there any special brushing protocol for differently abled children?
Yeah, exactly. That's a very good question. I was feeling very, I was feeling that I was really hostile to these people for not explaining this. See, not for not only for especially training children, especially able to children. It is you should try to start using powered toothbrushes. Power toothbrushes are battery operated toothbrushes. It is available online. You can have good companies, but it should be durable enough. It should be worth for your money you spent. That is the only thing you need to be aware of. You should use power toothbrush for that reason. For especially able to child, always use power toothbrush or battery operated toothbrush for as a brushing protocol itself. It will be very easy and very effective method also.
Okay, so there's another question from Beston Matthew. Is there any relation with the drinking water and the child's new teeth color?
See, I've told you, if there is a more amount of iron in your drinking water, the tooth color can vary. There are two types of staining of teeth. One is called intrinsic staining and one is called extrinsic staining. Extrinsic staining means when you smoke a tobacco, the smoking stains will get accumulated onto the tooth. That is called extrinsic stains. When you're taking some amount of medication, when you are in a very young age, when the tooth is in its developing stage, those drugs or even water or even iron containing water during the developing stage, when the child is in the developing stage, when he is consuming that much amount of water which contains iron or even fluoride, and that is going to create problem for the erupting teeth. After eruption, the amount of fluoride doesn't matter. During eruption, during the development of the tooth, this is going to create a problem.
Okay, sir. There's another question from Prajusha. Can low calcium level increase the chance for tooth decay? Avoiding sugar includes avoiding anything sweet, including jaggery, honey, etc. That's the question.
See, jaggery can be, jaggery is good for, jaggery is completely rich in iron also. Jaggery is rich in iron. Honey is also, there are a lot of nutritional value for that. You can add honey or jaggery in spite, but the only thing is it should not stay inside the mouth. It should go completely inside. You should not stay inside the mouth, whatever you use. If you are using jaggery, if you are using honey, but if you are clearing the whole thing from the mouth, then it is okay. There is no issue at all. That is my answer. You should clear the contents of what you give as food from the mouth. It should completely go inside the stomach.
Okay, sir. There's another question from Hariharan N. What is the role of mint in a toothpaste?
You just have a cooling sensation. That is it.
Okay, okay, sir.
More amount of peppermint, if you're using more amount of peppermint, that can cause other problems. That can cause some granulomatous lesions also. They have to be careful about using more amount of mint also.
Oh, okay, sir. Okay. So, is there another question from Asha Kailas? Is there any method to stabilize a tooth which has grade 1 or grade 2 mobility directly into the gingiva?
See, that depends on
Is
what
that
is the
pronunciation
cause
of the term right?
yeah, that is true. Gingiva, correct. So
Yeah.
the thing is, if it is a grade 1, grade 2, grade 3 mobility, the thing is you should know why the tooth is getting why the tooth is being mobile. If it is due to periodontitis, you will have to correct the periodontitis first. Or if it is due to trauma, then you can stabilize it. Any number of like if it is a very young patient, it will give you good results. As the age advances, the result will be very less. You should know the reason. Any treatment protocol, you should know the cause. You should know the cause first, and then go on for the treatment.
The
treatment is going to be a success.
Ida.
Yes, sir.
It's almost 8 o'clock.
Yes, sir.
We will collect the questions and answer later.
Okay.
You can mail it to me, or you can I'll just answer everything back together. No problem. No problem.
Okay, sir. Can we wind up? Yeah, okay, sir. Then, as we come to an end of the question answer session, and the rest, hope we can send it to you by mail. And we can end. We have come to the end of today's event, and now I would like to request Professor S. Nandan of Internet Society to deliver the word of thanks. Can we have you, sir?
Yeah. Good evening, ladies and gentlemen. Thus, we have successfully concluded the 27th session on the weekly webinar series organized by 7 professional bodies, societies organized by IEEE Kerala Section, then in the Institution of Engineers, Kerala State Center, Computer Society of India, Trivandrum Chapter, Project Management Institute, Kerala Chapter, Internet Society, Trivandrum Chapter, Vakka Maulavi Foundation Trust, Trivandrum, and IEEE EMBS, Kerala Chapter. So on behalf of all these organizations, I feel it's my privilege to deliver the word of thanks. So it was a wonderful session, beautifully delivered, all about children's dental health. So the speaker of today's session, Dr. Gobu Harindralal, MD, has wonderfully explained about the kids' dental health, right from the fundamental terminologies like, say, oral cavity, crown, root, enamel, eruption, etc., etc. So he also explained the tooth decay, the keys, triad, the role of salivary pH, and thanks for explaining about the Stephens curve and its importance. I have seen somewhere that before. So you have wonderfully shared about things to be taken care of to avoid tooth decay, the brushing practices and techniques, about orthodontic treatments, etc., etc. And that was really amazing. And from the bottom of my heart, representing all the associated societies, the professional bodies, and all the participants here, I would like to thank Dr. Gobu Harindralal, consultant periodontist, for spending his valuable time with us, sharing the information all about the dental care of our kids, and for patiently answering all the relevant questions. Thank you so much, sir, for your valuable time. Thank you.
Thank you, sir. And Gopu Harindralal, sir, once again, thank you. Your session was indeed very informative, even for those who are adults. And we had children also attending the webinar. There was a question from a kid also. I was just
about to my question is not answered, Dr. Nangal, it seems.
And I wanted to read out the question, but unfortunately the time is exceeding, so we need to stop. And once again, thank you so much. Beautiful session, sir. And
thank you, sir.
It is very informative. It was very informative, even for all the adults around, not just for kids. And with this, we have come to an end of the 57th talk of the Inter-Society Weekly Webinar Series. Is there anyone talking? I hope so. No, yeah. Okay. So with this, we have come to the end of the 27th talk of the Inter-Society Weekly Webinar Series. And next, so next we have the 28th talk of the Inter-Society Weekly Webinar Series. And it is on engineering applications for neurological disorder. And it is yet another beautiful session that's awaiting. And it is by Korathupi Varghese, who is a former HOD of the Division of Clinical Engineering at SET-IMST. And that will be on the 21st of October, Wednesday, from 6 to 7 p.m. And hope all of you will be there to support that session as well. And please make sure that you guys, all of you fill the feedback form that is attached along with the registration. So thank you so much. That's with this session. Thank you and have a nice day.